Thank you to everyone who is here live and who will be watching us later on our YouTube channel. We are the Interstitial Cystitis Association, or the ICA, and this is our monthly expert speaker series. Today we're going to be talking about advocacy efforts. So a little bit about our organization. If you're new to us, we are the only national nonprofit in the United States dedicated to providing advocacy, education, and community to those in the IC-BPS community. I am your CEO, Claudia King, and our COO, Laura Santuri, is here as well. And we are the only two full-time employees of the ICA. We are also, though, backed by a wonderful and active board of directors and a medical advisory council. So you will see those faces from time to time as well. So the components of what we focus on, our pillars, are advocacy, and that's what we're going to talk about here today. So we regularly engage with elected officials, and we advocate not only for awareness and education funding, but also research funding for IC. So looking for a cure, of course, but also treatments that will be helpful to a large patient population, and then making sure that our community and healthcare providers are educated and aware of what IC is, so that we can trim down that time that it takes patients to get their diagnosis. On an education front, we provide a lot of different resources. So we do have our website, and I want to share with everybody that we are in the process of an overhaul of our website. So we are very excited about that because it's going to make things easier to find on the website. It's going to be more comprehensive, and it's all going to stay evidence-based. We also provide a printed magazine called the ICA Update 3 times per year, and that next issue will be coming out, I would say, in the next month or so. We do an e-news monthly, which is an email that comes out, a little newsletter that we do to share what's going on in the community. This expert speaker series we do monthly, and as most of you know, and hopefully all of you will soon know, that is now free. All of the speaker series webinars will be free to anyone that wants to attend. And we now have a research digest, and that is put together by Laura herself. And what she is doing is taking current research and breaking it down into language that even I can understand. We also have our community, so our network of support, and that primarily lives on social media. So not only do we have our social media pages, but we also have private groups, both for patients and for patient supporters. I'm going to run quickly through how to use Google Meet because, as Josh just said earlier, he's not as familiar with it. So in case you are not as familiar with it as well, I'm just going to go through a couple quick tips on some helpful features. So first, if you want to turn on closed captioning, so if you want to read what I am saying instead of listening to it, then all you have to do is go to the bottom center of your screen, and you'll see that little CC button that you can hit to turn on your closed captioning. If you want to share an emoji or a reaction, so if you're super stoked about something that we're saying, or super unstoked, then you can go to the smiley face button right beside that closed captioning, and you'll see a lot of different emojis that pop up for you to choose from. Next, if you want to use the chat feature, so you will see that all the way to the right side, right beside the people, and it looks like a little thought square. It's not really a thought bubble, but it's all the way over on the right. That will cause your chat screen to pop up on the side, and you guys will be able to chat with one another as well as chat with us throughout the presentation. If you want to adjust any of your settings, you'll see that 3 dots right beside the hang up. Don't accidentally hit the hang up or we will be gone. Just hit that 3 dots and you can adjust your various audio settings. Normally, you would be able to adjust your video settings as well, but since you're not on video today, only we had to brush our hair. You did not, so you don't need to worry about that. If you want to adjust your speakers, then once you hit that three dots, you see the audio is highlighted, and you can change your speakers. You can change the volume of them through your own device. But that way, if you want it to come through your device, or if you have earbuds like I do, you can change those options right there. I am now going to pass it over to our real experts for the day, Phil and Josh, who are going to share kind of Hill Day and advocacy and what we do in those regards.
Great. Well, thank you, Claudia. Good to be here with all of you. For those of you who don't know me or haven't seen my any of my videos on the YouTube channel before, I'm Phil Goglis. I work here in Washington, D.C. on behalf of the Interstitial Cystitis Association, and it's been my honor and pleasure for the past 10 years to be working with ICA on advocacy efforts, and we have been a very, very, very successful organization when it comes to advocacy and the work that we do here in Washington. I always like to use the example of the ICA Education and Awareness Program as sort of a measuring stick. When I started working with the ICA a decade ago, that program was funded at $650,000 per year. But over the years, we got incremental increases. And today that program is funded at $1.1 million. And that's not any small feat to do, to increase a program like that by a substantial amount. But it also doesn't happen without the work of advocates. So Josh and I, as ICA's representatives here in Washington, do have a lot of interactions with Hill staffers, with key members of Congress, with the administration. But what really drives everything home is that advocacy from constituents, from all of you who are engaged and discuss what your experience has been with IC, whether it is as a patient, as a caregiver, as a loved one, and why it's important that the member of Congress support those priorities. So we traditionally have an annual event on the Hill where we have folks who come in, we have meetings with their House member, with their two senators, and we really focus on, one, educating lawmakers, but also asking for specific support in priorities. And we actually just had a Hill Day last week. So this time last week, we were preparing and we were active on the Hill. But historically, what we have focused on is really elevating the voice of the IC community, empowering our folks in the community to advocate, because I know that many folks will hear advocate, will hear action alert, will hear, reaching out to your elected official and say, well, I don't think I can do that. That seems like a lot. I'm not very well versed in policy. So what do I say? How do I interact? And what's critically important for you to understand is the ICA is a valuable resource to help you through that process. We have a lot of materials that, like Claudia was mentioning, that Laura does. We provide a lot of materials as well that really boil down the legislative process. So you don't have to be an expert in the committee process for bills and how to write a bill or anything else, but really be an expert in what your experience has been. But we provide a lot of key information and materials for you to utilize to be able to engage with your member of Congress. I can't stress enough how important advocacy is, because that is what really moves the needle for these offices. And I don't want to blend too much, but we have a lot of good experiences, especially last week when we were on the Hill, meeting with folks who are new members of Congress and engaging with them and talking about, what the needs of the IC community are and getting a positive response. And this is not a partisan issue, but we are not a Republican condition, a Democrat condition. We are bipartisan in the work that we do. We have great working relationships with Republicans, great working relationships with Democrats, and they work together on behalf of our community. I specifically want to shout out two members, and they are pretty important folks in the House of Representatives, and that's Tom Cole from Oklahoma, who's a Republican. He's the chairman of the Appropriations Committee. And then Rosa DeLauro, she's a Democrat from Connecticut, and she is the top Democrat on the Appropriations Committee. So they have worked very closely over the years on supporting interstitial cystitis research, education, and awareness. And we also have a number of supporters on the Senate side that have supported our continued inclusion in the Department of Defense's peer-reviewed medical research program. So we are very fortunate to have robust research through NIH, through DoD, and then dedicated funds for education and awareness activities. And again, all of that is a result of your work in reaching out and sharing what your experience is. So that's a little bit of the history. Josh, I'll turn it over to you to just go over the general structure of Hill Day and just walk everybody through how everything went last week.
Yeah, thanks, Phil. And, first of all, I know that Phil's face is probably very familiar, to some of you. But, just, reintroducing myself. My name is Josh Fine. I work as a legislative consultant with the Health and Medicine Council, on behalf, of the ICA, and been working more closely, with them since last September. But yeah, we had a very, successful, advocacy day last week. The structure was pretty simple. I believe we met with, almost 20, offices between, the different teams. So we had three groups or teams, as we like to call them, that were going around, and they were meeting with their, senators and representatives that are from their states. So I was with, Laura's team. We met with, the Ohio, her Ohio representatives. Her new senator, Bernie Moreno. We met with his office, and actually, when we were having the meeting in the hallway, because he is, as a new senator, it takes time to get like a full office. So they were in the basement. We actually ran into the senator, walking back from, some other activity, and he was, nice enough to, introduce himself, say hi. So that was, a nice little surprise, as well. But essentially, the way that, the Hill Days always work is that we group a few different states together to ensure that it's not just me having 1, 2, or 3 meetings with your own state, but that you join other people's states, so that every team has 5 to 6 meetings, and I believe all of the teams last week had 6. So we started out in the morning. We met at our office. We walked over to the Senate's office buildings, which is very close to the Health and Medicine Council's office. On Capitol Hill. We got a nice photo, with the Capitol in the background, which, may have been posted on social media. So you may have, or sent around in an email. So you may have already seen that, with all of, the advocates together. And then we split off into our different teams. So, it was Laura in one team, Claudia was in another team, with Phil, and, they were meeting with, her Colorado members, Senator Bennett, Senator Hickenlooper, and then the House meetings in the afternoon. But, all the different groups had around 6, total meetings. So they started off in the morning meeting with, their individual Senate offices, discussing our priorities. And on the Senate side, the peer-reviewed medical research program is particularly important because the Senate is the chamber of Congress that, takes the first lead on drafting that list every single year. So that was of particular importance, talking about, how the IC being listed on the eligible conditions list for the PMRP for many years has been very, important for our community because it gives us access, to a pool of money that simply we would not have, the ability for our researchers to compete with without it being on the list. And this is a list that, even though we've been included in many years, it basically starts brand new every single year. So it's not something where, we're in once and then we don't have to worry about it again for another 5 years because we're good. Each list is different for every fiscal year. So even though we were on, fiscal year 24, 25 that just concluded, we have to be on the Hill advocating again, for fiscal year 2026. Because if we decided, we've been in for a few years, I'm sure they'll be nice enough to just include us again. That's not really how the process works. If you don't put in the work, not just 1 year, but every single year coming back to the Hill, and me and Phil doing our, additional outreach that we do on behalf of, the organization, then you get left behind. And, we know for a fact that does happen. So that's why we're there again, talking about the importance of, continuing to list, interstitial cystitis, on that program. So the Senate meetings were in the morning. We had a nice lunch in the cafes, and then we just made the walk over, to the House side. If you're not familiar with DC, just Capitol Hill, how it works, you have the Capitol in the middle. There's the Supreme Court, the Library of Congress. One side of the Capitol and those buildings, you have the Senate office building. So that's where we were in the morning. But then the other side is about a 10 to 12-minute walk. And that's where all of the different House office buildings are. So we started out, in the Senate, and every state only has 2 senators. Then we made our way over, for the afternoon meetings, which were with, everyone's individual representative. And, just a reminder that every, person only has one, member of Congress that represents their specific district, usually around 700,000 people, per district. So everyone's going to have 1 House and 2 Senate members that represent their entire states, not just the districts. So we did those meetings in the afternoon. And on the House side, we were, particularly talking about the importance of the CDC program, especially because, as Phil was mentioning, Rosa DeLauro, Tom Cole being, champions, for the program. We, specifically wanted to highlight, the importance of, maintaining the funding, but also giving us an additional increase of $400,000, because this is as Laura's, talked about before, the only, dedicated funding for education and awareness, for IC at the federal level. And we were talking about the importance of increasing the funding for the National Institutes of Health as well. The community-wide ask for this year is $51.3 billion, which is the same as it was last year, because all of the public health programs were level funded from FY24, so they were the same, as FY25. But we're asking for $51.3 billion, which is in line, with what other patient advocacy organizations are requesting. And of course, our main research portfolio is at the National Institute of Diabetes and Digestive and Kidney Diseases. So we were highlighting that, as well. So those are the main 3 asks. But ultimately, we had, a few meetings in the Senate in the morning, a quick lunch. Then we went over to the House. But I think it was a very successful day. At least the meetings that, Laura and I joined for, were very good. But, we heard very positive feedback, from everyone. And we'll be following up with additional advocacy opportunities later in the year. So we'll be sending around something that's called an action alert. And this is something that is a way to keep people engaged, even when you don't have the chance to go to the Hill. So this is basically just going to be a template, email message or even a phone script that basically just says, thanks for supporting our community. Please, list interstitial cystitis on the peer-reviewed medical research program. So that's something we'll be sending out, but it's a great way to stay engaged. And you don't have to feel like, oh, just because I'm not able to travel to DC in person doesn't mean that you can't be contacting your offices, because, as me and Phil can tell you, that absolutely matters a lot. It's great for us to go in, but they really care about what you think as the constituents. So sending them a message saying, I live in this state, this is my hometown, your boss is my senator, your boss is my member of Congress, that really does matter. They take that into account, when they're deciding what priorities they're going to fund higher the CDCIC program and what conditions are going to be on that list that the Senate compiles. So it's very important. And so we'll be sending that out, but it's a great way to stay engaged and for you to have, an ongoing relationship with your offices and getting familiar with the staff members who work specifically on healthcare for the members that, represent you. And the other thing that we may be doing is having virtual meetings. So, since COVID, it's become especially popular, not just, in many areas of business, doctor's appointments with telehealth, but now congressional staff does virtual meetings too. So that's another thing that, we'll probably be talking about specific dates, later this year. But it's a great way that, if you couldn't make it to Hill Day or, traveling may be a little bit difficult, everyone can just do it from the comfort of their home, like right now. And all of this gets coordinated, with you ahead of time so that we make sure that everyone's available. But that's another opportunity where, it's just as effective. Yes, it's great to go in person. It's always nice to have that connection, but sharing your stories to your members through, these Zoom meetings is also, something that's important, and is also a great way for us to follow up on, any additional outreach that we did earlier in the year. So with that, I hand it off back to, Phil, Claudia, and Laura, but please don't hesitate to reach out to any of us, if you have any questions or you want to learn more about, some of these advocacy opportunities that I was just talking about.
Absolutely. So I'm going to bring back up the slide just to reiterate some of the things that Josh just talked about. These are our legislative priorities most years on the Hill, and certainly were our areas of focus this past week when we were there. And I just want to reiterate that these three things are the main sources of any research funding for interstitial cystitis and bladder pain syndrome. This IC Education and Awareness Program is here because of the ICA's advocacy work, and we are incredibly proud of that. Not only increasing the funding over the years, but just keeping it around and maintaining it. These funds, as the name of the program indicates, are not just for research, but also for patient education and raising awareness of this condition, both in the medical community and in the general community. And certainly the funds coming from the Department of Defense's program and the NIDDK are absolutely essential for us to move forward the scientific knowledge on this condition. So we're incredibly proud to be the only organization on the Hill advocating for these funds and representing the patient voice. And I will just share kind of some pictures in the backdrop because we all took some photos. Everybody got some nice photos of the Capitol building. Some more artistic than others. But I would want to share too, from the patient perspective, if you're thinking about getting engaged, I just want to highlight how important it is, and Josh and Phil alluded to this too, but the patient story is really key. That is how we make connections with our representatives, and that is how we connect policy to people. If we don't come talk to them about how research funding or the lack of research funding has an impact on our daily lives, I feel like it's a little bit easier for them to see the words interstitial cystitis on a piece of paper and think, well, what is that? How important is that? But it's harder for them to dismiss the condition if we have come and put a face to the name. And so even though it can be challenging, I will say, spending the entire day on the Hill, sharing your story over and over again, it takes a little bit of a toll, but that is where we make those connections and that is where we make an impact. So I just want to reiterate that you do not have to be a lobbyist to do this work. And towards the end, I know Phil and Josh are going to talk a little bit more about how you can get engaged and some concrete things that you can do. But I just want everyone who's joining us today or listening to the recording, I don't want you to be overwhelmed by the prospect of engaging in this type of advocacy work, because all it requires is a willingness for you to share. If you're willing to share your story, you can absolutely make an impact. Claudia, I'm going to let you jump in with anything else that you might like to share about your experiences on the Hill. And I know you've got some exciting news for our community too.
I do. So my experience was really wonderful, to be honest with you. I had the opportunity to meet with 8 different offices, and no one in any of the offices that we met with knew what IC was. And that's okay, because what that allowed us to do was to educate them. That gave us the opportunity to share with them what is IC, so now they know. Now they have the ability to talk about it with somebody else. So I consider that in itself a win. I will say that it was also great on my team to have kind of a range of conditions with IC. Myself, who is able to travel a decent amount and is able to work, and we had somebody in our group that unfortunately is no longer able to work because of their IC. So it was great to have different stories to share with our different representatives. And I will say that for the most part, they were very engaged. They were very inquisitive. They wanted to know how many people this is affecting. They wanted to know how many people in their own area this is affecting. So it was really fantastic to have that opportunity to share with so many different individuals. Just have a couple more pictures here of some of the different offices that we were able to visit. So our next big piece of exciting news is that we are going to be hosting a convention next year. Now, if you've been familiar with the ICA for a really long time, then you'll know that we used to do annual conventions, and we want to re-engage that. So Laura and I have made the decision that on April 10th through the 12th of 2026, that we will be in Denver. And not only will we be in Denver, but we're going to have some other really amazing people there as well. So we're going to be inviting researchers, healthcare providers, advocacy experts like Phil and Josh, and then you, the patient. And what we want to have happen is we want a lot of education to be going on, not just from urologists, but from physical therapists, from people who deal with emotional conditions and that aspect of IC. We want you guys to connect with one another. We want you to network and find the people just like you that you can count on at 2 a.m. when there's nobody in your town that's dealing with what you're dealing with. And we want to have fun. So a lot of times the negative takes over when we're talking about IC. And it's easy to talk about the challenges that we face and the difficulties that we deal with every day. So while we are going to be talking about those, we also want to have some fun. So we're planning some very specific activities that will ensure that you guys can connect with each other and have fun at the same time. So as we gain more details on exactly where we're going to be in Denver and different ways that you can get there and be involved, we will definitely be sharing those with all of you.
All right. So Josh and Phil, I wonder if you could talk a little bit about, if people who are either joining live or listening to the recording are thinking, gosh, I would like to get engaged in being a patient voice on the Hill or elsewhere to promote and advocate for this community. What are some concrete things that our community can do to get involved?
So I think the biggest thing is just reach out to the ICA and say, I want to be involved. And as I mentioned before, we have a number of materials that we use, but Josh has talked about action alerts. There are a lot of things that we focus on, and advocacy is not, while everybody was here last week on the Hill, that's not the one day a year we just do advocacy. Advocacy is every day throughout the year. Advocacy is not just in the springtime or when you're here in Washington. It is year round. So there will be a number of opportunities to engage as the appropriations process continues to move forward. And as we were talking about with our priorities, we want to make sure that the IC program continues to be fully funded. We want to make sure that it's funded at $1.5 million, which is an increase of the current level. And the way that that gets done is by members hearing from their constituents, hearing from their voters, from the folks that they represent, asking them to support these critical priorities. So there will be some action alerts that will be disseminated out to the community, specifically on the education and awareness program, but also, as Josh was talking about, the Department of Defense's peer review medical research program. That is an annual activity that we have to do. It's not something where you can do it and you're good for 5 or 10 years. That's something we must do every single year. And of course, being a condition on that list each year is great, but it doesn't guarantee that you'll be there the following year. The way we get there on an annual basis is by having folks reach out to their senators, asking them to support it. So the biggest thing that I just implore folks to do is just reach out to the ICA and say, I want to participate. I want to advocate. And I know that there are folks who may say, I've never done this before. How do I remember $1.5 million? How do I remember Josh mentioned $51.3 billion? How do I remember all of that? The good news is you don't have to. We write all the materials for our advocates. We prep everything out. Those who came on the Hill last week, everybody had a prep packet with background information, with talking points, with a script. So we provide all of that information for you. The most important thing that we ask from people is to just share their journey, share their experience. And I was lucky enough to be in a group with Claudia, with Shelley, with Amber, and with Callie, and we were able to have robust discussions, but I wasn't the one who was talking about what IC is. Claudia was talking about what IC is, what her experience has been with IC. Claudia did talk about the priorities, but when there were more technical questions, I answered those questions. So it wasn't as if Claudia had to be an expert on anything but what her experience has been. So I just want to make sure that everybody knows it's very user-friendly. It's very tailored as well. There's a lot that's happening here in Washington. You don't have to be an expert in the legislative process. You don't have to know who everybody in a position of power is. That's what we do on behalf of ICA. So the most important thing is just be willing to share your story. And I know it can be intimidating at the beginning to share something that's personal for a lot of folks, and it may not be very comfortable. So I encourage you, and I'm sure that Claudia and Laura will agree with me here, but I would say reach out to Claudia and Laura. They've done it before. They were first-time advocates at some point where they, had never gone into a congressional office before and shared something so personal with a stranger. And I know that that is not the easiest thing for folks to do, but it really does make a difference. So I can't thank you enough in advance for being involved in advocacy. But the best way to get engaged, again, reach out to the ICA, say, I want to participate. You'll be looped into all of the materials that we have. And as Claudia was mentioning about the convention in Denver, this isn't something that is just cut and dry. We want to make sure that it's a strong sense of community as well. So when you advocate, you are not advocating alone. You're advocating with everybody else who is using their voice to uplift the needs of our community.
So let's open it up for some questions. I know we've got a couple people joining, so if you have questions, please feel free to put them in the chat. I'd like to kick us off with a question. This is a question that I get fairly often, and it usually starts with, but I'm just one person. What difference can I possibly make? And I wonder, Phil and Josh, if you could speak a little bit to when you hear somebody ask that question or express that concern, what is your response to that?
Yeah, Josh, I'm happy to go first and then turn it over to you. Congressman Tom Cole is one of our biggest champions, as I mentioned before, and that's just because of one person who made that connection with his office. We have countless other supporters of ours over the years that have been willing to use their voice to elevate the IC community, and it's because of just one person developing that relationship. So there are strength in numbers, and that's why we work collectively across the nation with a grassroots organization approach to it to say, Claudia has her connections in Colorado, Laura has her connections in Ohio, Amber has her connections in Florida, Shelley has her connections in Pennsylvania. So how do we leverage those different opportunities, but those relationships as well, to collectively say, now we have Laura's two senators in Ohio saying we need to support interstitial cystitis. Claudia's two senators in Colorado are saying we need to support interstitial cystitis. Same thing for Amber and Shelley. So if you just use those four individuals, you're looking at 8% of the Senate, because there are 100 senators. So 8 senators saying we need to support or do something on interstitial cystitis. So that really does have a strength when you have somebody who develops those relationships. So again, I know it's one of those things that can be daunting, and you look at the news now and you see all these things that are happening, and the question is, how can I make a difference in terms of elevating this? How can I, just one person, cut through all of the noise? But I promise you that one person truly does make a difference in the work that we do.
Yeah, I'll just echo what Phil said. Particularly, of course, the Senate, but remember that every House district, is the same amount of people. So you're not, it's not like a big state like California where there's 40 million, Texas, Florida. These are individualized, so they really care about what's happening, in their, not just general, I live in this metropolitan area, but their specific districts. So coming every year to the Hill, and talking about your story is going to be very impactful, especially from areas like, for example, me and Laura were with, Holly. I mean, she is from a rural, very rural part of Louisiana that it's very unlikely that, their office is getting, that many patient advocates, are even able to come because, as you were saying, she has to drive, long hours just to find, proper care. So when you especially have advocates coming from some of these more, rural districts or parts of the country where, maybe people like aren't as active and engaging, with their offices, that's something that could be, very even more, impactful. Of course, any advocates coming and telling their story, and talking about what's happening in their community is of interest to the members, but, particularly, getting people from every, different corner of the country, is just a great way of advocating, as we always like to talk about, in the grassroots, where it's not just one person from one state, where we're in a unified voice. So people from Los Angeles, saying the same thing as the people from New York City, to Holly, who's in, rural Louisiana. It's the same message that every single different office is hearing. Promote the CDCIC program, give us robust funding, NIH funding, NIDDK, keep us on the PRMRP list. So advocating together and being coordinated, is also just, a very, great way to make our priorities heard. But, it's about the people that come every, single year. Me and Phil work with many, advocacy groups, and, we can tell you that, some of these congressional offices have been around for a while, and for advocates that come every single year, they remember and their staff member, they're like, oh, we met with this person last year, but they're coming again this year. That's how you make yourself, memorable to these offices, because they're balancing so many different priorities. There's so much going on. These offices sometimes get inundated with requests. It's about the people who are emailing them every single year, but not just one time, multiple times. Please keep us on the PRMRP list, coming to the advocacy days every year, doing virtual meetings. The people that stay engaged, and, are continuously reaching out to their offices are the ones that, are most memorable. And when they're considering their priorities, they're like, oh, we've heard from these people, a lot. So, we're going to make sure, because we know that, if we don't, if we're not supportive, then, our constituents are going to be upset, moving forward. So, it's really just about staying engaged, continuously, and not just making it, as we talked about, a one-off thing, but doing the work every single year. That's the way, to make your voice heard most effectively on Capitol Hill.
I also got a question earlier. We've talked a little bit about different ways that you can meet with your representatives. So the question is an in-person meeting, a virtual meeting, a phone call, or a letter better or more effective? So is there a particular way that people should focus on reaching out, or is there one that's more effective than another?
So I would say all of the above are effective. There is no, and that's the beauty of advocacy, if you want to view it that way, is there's no one specific way where if you go and fly to DC, you get more of a response than if you call. There is an expectation, and you should expect that anytime you reach out to your member of Congress's office, that you will get a response. If you go onto their website and fill out their online contact me forms, that goes to their staffers. They catalog all of that. They keep a database of all that information to see who's reached out to them on specific issues. If you call an office, they will of course ask for your zip code to just double check that you live in their district. If you don't, they'll be polite, but they won't really do anything. But if you're in their district, they'll take copious notes, ask where you live in the district, ask how they can be helpful. And then most likely you will get some sort of email, letter back from the member themselves, thanking you for reaching out and sharing your concern. If you set up a virtual visit, that's, good as well, to be able to have that opportunity to have the conversation if you come to DC as well. But I think the most important thing to remember is that advocacy isn't a one-off activity. So if it's phone calls that you're making, making sure that you keep that office up to date on what's going on. So if I were to call, Chuck Schumer's office in New York, for example, and say, I really want you to support robust funding for the CDC IC program, robust funding for NIH, and continue to include IC in the peer review medical research program, I then would follow up, in a few months saying, now that the bills are moving forward, please continue to support this. And a few months later, reach out again. And that's where we come in with the cadence as well, to just say, here's an action item for you to respond to. Here's how you can do it. So there never is a bad way to connect with your member of Congress. Each touch point is critically important. And I think the other thing to remember too is share with the ICA any interaction you've had, because it's helpful for us too, because then I know, and Josh knows here in Washington, if you've reached out to your senator and you've gotten a positive response, there's a very good chance Josh and I are going to be in a meeting with them at some point that we can then bring it up. And that's what we do on a daily basis. There are countless staffers who we will meet with, sometimes up to 4 or 5 times a week with different things that are happening. So it's always good for us to know, to have that follow-up as well, to connect the dots for their staff as well.
Could I piggyback off that question with another question that I often get asked? And it relates to, if I want to meet in person with my representative, should I do it? Do I have to do it on the Hill? Can I do it locally? Which one is more effective? What is the timing for either of those? How do I know when to make arrangements? Can you speak to a little bit about that?
Yeah. So again, there is not one better than the other. The DC folks are more policy oriented, but if you go into Columbus, Ohio, and you meet with Senator Houston's local staff there, they will loop in their colleagues in Washington. And that's why it's important to share with ICA that you've had a meeting with an office, what the response was, because then we can follow up on the DC side here saying, Staffer Bill, we know that Laura, who's a constituent, met with your colleague, George, in the Columbus office. This is what they talked about. Here's some more information. If you have any questions, please do let us know. But if you are, again, interested in doing a meeting in person on the local level, reach out to ICA, let us know. We can help walk you through that process in terms of who to reach out to, how to get that scheduled. But there are specific times where that will be a lot easier to facilitate than others. For example, this week and next week, both the House and Senate are in recess, so members are back home in their districts and states. Last week they were all here, so last week wouldn't have been the best time to do a local visit because a lot of the focus was on what's happening here in Washington. But when they're in recess, specifically during the month of August, that's the perfect opportunity to have those local visits. And I also want to stress too, advocacy isn't just scheduling a meeting with the office or anything like that. If you see your senator at a fair or a parade or any event in the community and you say, hi, Senator, I'm Claudia, and I'm an advocate with the interstitial cystitis community and the ICA, and you share a little bit, that's advocating. So advocacy isn't just, in the halls of Congress or in a local office. Anytime you're using your voice to educate a policymaker or their staff and asking them for support, that is advocacy. So I also want to stress, I wouldn't recommend chasing people down in the supermarket, but if you happen to see your House member or senator in the supermarket, you can say hello respectfully, and you can, if the opportunity presents itself, to be able to have that elevator pitch of 30 seconds to a minute to just share some information with them. That's always valuable as well.
So no stalking is what I'm hearing there.
No, because we will not bail you out of jail. No,
we will not. Absolutely. Another question is, if I can only meet with one elected official, is the senator better than my representative?
So that could depend on the committee of jurisdiction that they serve on. So again, that would be a situation where I encourage reaching out to ICA and saying, this is where I live. Every House member is important, But for our purposes, if somebody is on the Transportation and Infrastructure Committee, that's great, but they don't have any direct oversight over our key priorities. If they're on the Appropriations Committee, that's important. If they're on Energy and Commerce, that's important. Ways and Means, that's important. So reaching out and letting us know with your zip code where you live in your state, so that way we can identify who's your House member, who are your senators, and then we can see, you know, if you live in Alabama, for example, and you live in Congressman Adderholt's district, you're a twofer because he is the chair of the Labor Age Appropriations Subcommittee, but Katie Britt, the senator from Alabama, is an appropriator as well. So there are two great opportunities to engage both of them on these issues. But if you have somebody who, again, your House member's on Transportation and Infrastructure, but your senator is Susan Collins and she's the chair of the Senate Appropriations Committee, that's great. You know, we want to make sure we're engaged on that.
All right. Any other questions or comments from anyone? Feel free to pop them in the chat, or anybody who is live. If there's anything else you want to add, please feel free to do so. All right, we're going to wrap things up. I want to thank everyone, both those who have presented today and those who have attended. I really appreciate the discussion we've had today. Advocacy is so core to who we are as an organization, and this is such an important topic, and we can't do it without the patient voice. So thank you to the Health and Medicine Council who help us do this day in and day out, and to all of the patients who are willing to share their stories. It means the absolute world to us. As a reminder, I just want to let everyone know, if you're interested in connecting with us, we've said numerous times actually during this webinar about if you're interested in doing more advocacy work, please reach out to us. And probably the easiest way to do that is our email address at icamail@ichelp.org. But there are so many different ways to engage with us as an organization, certainly checking out our website. And as Claudia mentioned at the start, we have lots of different ways that we educate our community. You can sign up for our e-news. You can donate to help support the work of the organization. We certainly appreciate that. And for those who donate $50 or more, you do get that hard copy of the ICA update. But you certainly, if you opt in, you'll also be getting our research digest. And you can find us on a variety of social media platforms. So we welcome you to connect with us there. As always, if you ever have any questions, you can reach out to us and we will help you in any way that we can. But thank you everyone for joining today. Appreciate you.